So we have some questions from the audience to both of you, and whoever wants to answer first gets to answer first, and then we can move the word to the next person. But one is, how can healthcare providers assess the value of digital health technologies when deciding on such investments? Sort of a buyer's guide to health services.
Do you want to answer, Julie, or
I can take a first stab. I think that's a really interesting question, because I'm not sure that at the moment health professionals are involved in considering the value of innovations. And I'm curious as to how they would think about it. And I think so much of when you speak to frontline staff, I think so much of their frustration is not being able to do their job well. And they're feeling that the system is conspiring to make it more difficult to do their job. And that these new ideas, whilst they're well-meaning, they don't achieve the impact. And they often just make their work more difficult. So I think for staff, like, you know, does it make it easier to deliver care in the right way? And does it make it easier to do my job and to take pride in my profession of caring for patients and providing the best care? I think those are likely to be at the forefront of healthcare professionals' minds.
Great.
Yeah, and I also say that I think it is important that there is a need for the healthcare professionals to really do this. So, because, as I said before, the alignment of the innovation in relation to the shared values in the organization. I think that's a very important thing, to be really engaged and see that it is important for me to be with.
And we have a question directed to Julie. What is the status of reducing the cost of care and delivery by digitalization in the UK? And if, depending on how much you know about Sweden, compared to Sweden?
Oh, I don't think I have the knowledge to answer that question. I think the push for digital care in the UK has been difficult. So just as an example from one of our projects, they developed a new virtual ward so that patients didn't need to come in. They could receive a follow-up clinic to do with wrist fractures virtually. And it worked really well. It was better for the staff. It was better for the patients. But getting it commissioned was really hard. There was no structure to pay for this type of service, and they wanted to pay less. And then obviously that became a disincentive for the staff. Well, why would we, you know, we're providing the same time, but why we'd get less money, and that means we'd need to lose staff. And so all of these competing incentives. Of course, coronavirus has totally changed that in terms of this huge proliferation of digital care provision. So I think a lot of those barriers had to be removed very quickly.
Interesting. Do you know, Petra, about the status of reducing cost of care and delivery?
No, I cannot say that I know that.
Okay. Yep, that's fine. But you will still get another question.
Yeah.
So now we know why it's so important with the co-production and so on, and the participation of patients. We know why, but how? What is the next immediate action for hospitals or clinics to carry out, do you think?
I think it is very, because often maybe we have a co-production in some way in healthcare today, and then the patients are involvement in their own care, in their own care plans and so on. But as, for example, that I should look at the name, Jakob Wenzer told, we don't have a structure or an organization in healthcare that the patient's knowledge the patient's knowledge is important, and they have involvement in more strategic decisions. So I think that we need to have a more, for example, maybe a user panel or something that their patients really can have a real involvement, because I think that it is often more about like a tokenism, that they are with us, but they are not involved in decisions in a more strategical way.
Right.
So that I think is very important to do now.
And I remember, Julie, you said something about the cultural or the behavioral aspect being the hardest one, the hardest challenge. So Is that the biggest hurdle then for the healthcare providers to actually start working in different ways? Would you say that that's the biggest problem?
I think it's one of the areas that's most neglected and least talked about, but for the time it takes. So I think we're disproportionately minimizing it rather than paying attention. But I think one of my biggest learning from doing this work is the time it takes to build meaningful relationships. That often, if you think of this one by one innovation at a time, or one innovation, one problem at a time, so much of the time in setting up the project or the initiative is building these relationships and learning about each other's perspectives, building trust, building a shared language, building a shared sense of the systems you're working in. And that takes so much time. And if you have to start from zero each time you're approaching a new initiative, maybe 80%, 90% of your effort will go into just this relationship building, sense making. Whereas if you start viewing it as system level and thinking, how are we building long-term relationships? How are we building sustainable infrastructure to support continuous improvement? Then I think you can start to be much more efficient, move at much greater pace. But we need that global view, and to stop being innovation by innovation and thinking of a much more organizational or system level approach.
Yeah, yeah.
I agree with that.
Yeah. So we have a wide range of people in the audience, and this is one of those opportunities where you as researchers have a way to directly connect to a wider community than perhaps only other academics that read your papers. So what would you like to take this opportunity and say a tip or a warning or something to this audience? What would you like to tell them and bring with them?
It is not, maybe it's not so easy, but the implementation of different innovation is very complex. And the tip I give is that the stakeholder and the users needs to be included in the beginning of the project. So not only when the project is, they have a project or they have they have a solution. So maybe we have an AI solution for something, and then we need to implement it, and then we engage the people. We need to engage the people much more before. They need to be in the beginning.
Right.
That's my.
Yeah. And Julie?
Yeah, I absolutely agree with aligning with what matters to people. And I think my biggest tip would be humility and perseverance. The idea, just to go in with this, you don't know the answers. No one person can understand how a system works. No one person can solve all of this on your own. So you will find that you will make mistakes, that things don't work out how you plan, and just embrace this as a positive part of a learning journey, and commit with that perseverance to overcome the unexpected challenges that you face.
Fantastic. Thank you so much. Thank you, Julie. Thank you, Petra.
Thank you.